Oslo, Norway, November 2010. Ministers, officials, and representatives from non-governmental organizations came to Oslo and participated in a high-level consultation to underline Europe's key role in the new global fight against non-communicable diseases. Human suffering, challenges, needs, and solutions were discussed at the Oslo meeting.
We need to empower all nations and all health systems in their fight against non-communicable diseases, including their treatment and their prevention.
So we now have, out of 58 million deaths occurring in the world every year, we have 35 million deaths caused by non-communicable disease, heart disease, stroke, diabetes, cancers, and chronic lung diseases. And out of which actually represents 60% of all global deaths. And out of this, we have at least 9 million people who are actually dying because of non-communicable disease before the age of 60 years.
Why is it important with the non-communicable diseases now?
Non-communicable diseases are the overriding priorities, both globally and also in the European region, and therefore we have to tackle it as the number one priority, and this has to be in the forefront of our attention for the coming years, and this meeting and this conference here is very significant.
When I listened to Susanna Jakob, the regional director this morning, I found it very important when she pointed to the need of involving the whole society. The whole society needs to do an effort. And I think this is also the biggest challenge, because the whole society means not only the health sector, but other sectors, not only the governments, but also civil society, and of course all other key stakeholders that have an impact on chronic diseases.
The Oslo meeting focused much attention on discussing low-cost solutions in preventing the spread of non-communicable diseases. One Norwegian example is the Physiotech in Drammen, outside Oslo.
What is important with this project?
It's to provide activity for groups or persons that needs helps to get in physical activity more than they used to be.
One of the target groups of the project are immigrant women, invited from the local area.
2, 3, 4, 5, 6.
I think the results, the participants what they are telling, the good stories, are very good results. What they are telling about their lives getting better, less medication, and what physical activity means in both physical health and mental health.
How did it change you to come here?
When I started here, I thought it will be difficult for me. But afterwards it will easier and it helps me a lot.
How important is prevention?
Prevention is a key area, and particularly the focus on children and young people, where so much of the basis for chronic diseases is led, is extremely important. And it is a lot to gain, both for the individual who don't have to suffer chronic disease for that long, but also for the society as such, as there is enormous cost associated with the high prevalence of chronic diseases.
The main reason behind the Oslo meeting was to prepare Europe for the upcoming summit at the United Nations in New York in September 2011. This will be the first time ever that the UN General Assembly will arrange such a high-level meeting on non-communicable diseases.
What importance do you think New York, September 2011 have?
I think that this event is of a great importance because it is now more than ever time to put a very important issue on the agenda of United Nations. For our region, for European region, and especially for perspective of low and middle income countries, it is of great importance to put non-communicable diseases as a topic.
What importance do you see on that meeting in New York?
I think it's the most important meeting, and that we must get our resources together to make certain that the same resources can be used to fight both communicable and non-communicable diseases. And in particular, as poor nations are climbing up the ladder, non-communicable diseases is becoming more and more important reasons for death in Asia, Latin America and Africa.
Many developing countries have to cope with the double burden of both infectious and non-communicable diseases that is overwhelming their healthcare systems. Action needs to be taken now to implement preventative interventions, including reductions in tobacco and alcohol use, overweight, and obesity. These are images from Cape Town, South Africa, just one of the countries in the developing world now facing an increasing epidemic of non-communicable diseases as a result of changed lifestyles. Here, an activist from a local NGO in Cape Town is trying to help housewives to quit smoking. A lot of the discussions also centered around how to get people to quit smoking, which is one of the key drivers of chronic diseases. In all Norwegian stores, logos or brand names of tobacco products are not displayed to the customers.
How would you describe smoking, the effects of smoking in society?
Smoking is one of the most deadly addictions you can have. 1 out of 2 smokers die of it, so we have to help people stop smoking.
In connection with the Oslo meeting, a special seminar was arranged for Norwegian NGOs who play a crucial role in mobilizing people and making them aware of the fight against non-communicable diseases.
What importance does the NGO have in this occasion?
I think the NGOs will be important partners for all countries around the world, because we can do a lot to prevent the non-communicable diseases, and I think we can be a force, and we can be a gardener and a watchdog as well on this work in the future.
Are you optimistic?
Yes, I'm optimistic. You have to be optimistic, even though the underlying trends are quite disturbing. It's going to be a very good year, a very intense year for non-communicable diseases. We have the regional consultations now. We're discussing this in the executive board of the World Health Organization. There will be the first global ministerial meeting in Moscow. The World Health Organization will have this on the agenda, and then finally the heads of state will discuss it in the UN General Assembly. If we cannot get anything out of that, that will be really terrible. So it has to be a good year to change the way we're dealing with this.